So now that we've reviewed how to interpret the acid-base portion of an arterial blood gas, we're going to start diving into the 4 specific conditions and what causes them and how they present. So the first one we're going to look at is respiratory acidosis. So the lab values that you're going to see in respiratory acidosis are a low pH and a high PaCO2. Now, because of the conditions associated with respiratory acidosis, it's also very likely that you're going to see some hypoxemia evidenced by a low PaO2 and low SaO2. The number one thing that causes respiratory acidosis is retention of carbon dioxide. Remember that we breathe out carbon dioxide with every breath. So think of it like the pressure release valve on a water heater. If the pressure gets too high, it lets off the steam. Well, our lungs do the same thing. If carbon dioxide gets too high, it will release the carbon dioxide by breathing faster. So if anything causes that pressure release valve to be blocked or to not work appropriately, that carbon dioxide gets stuck inside the body. Well, the most common cause is hypoventilation. Now, this could be a low respiratory rate or shallow breathing or both. Now, less breathing means less CO2 being blown off, and so it stays in our bloodstream. Now, this happens quite frequently with any kind of overdose on sedatives or opioids. So other possible causes of CO2 retention are obstruction of the airways or anything that prevents expansion of the lungs. Now, remember, it's all about gas exchange. So anything that's going to prevent proper gas exchange could cause us to retain the carbon dioxide. So this could be things like aspiration or COPD or asthma or even bronchospasm that obstructs that flow. Or it could also be some form of lung collapse like atelectasis or even a hemo or a pneumothorax that prevents the lung from expanding all the way. All of this can cause our CO2 level to be built up in our bloodstream. And remember that CO2 is acid, so more CO2 means more acid, hence respiratory acidosis. So the number one thing that you're going to assess in a patient with respiratory acidosis is signs and symptoms of whatever caused it. So you may see decreased lung sounds if they have a pneumothorax, or a decreased level of consciousness if they had some sort of overdose of a sedative or an opioid. So just make sure that you're thoroughly assessing those things in addition to the signs of the acidosis itself. Now, that would be things like decreased level of consciousness, confusion, and commonly they get quite restless or anxious. Remember that the brain is very greedy and it's very sensitive to changes in pH or CO2 levels. The brain just cannot handle it. And so those level of consciousness changes are going to be very common. They may also have trouble breathing or a headache. Those are all signs of acidosis. Now, it's also possible with acidosis that we will see vomiting, because this is a way for our body to just get rid of excess acid. However, because this is a respiratory source, it's much less common than it is with metabolic acidosis. The lungs will just take over and breathe faster. The other things that we will see are muscle weakness and arrhythmias, and that is related to the hyperkalemia. Remember that the excess hydrogen ions outside the cell